students, we are starting medical surgical nursing, that is unit 9 in your syllabus, renal and urinary disorders. So we will see the urinary disorders we will see. So first we will go to assessment of renal and urinary function. So how do we assess? So already you have the book, you can go through the notes. Okay, so first we will see the history. So what all we have to keep in mind when we do the history collection for patients suffering with renal problems. So coming to demographic data. So when we see demographic data, we have to ask the age, gender, race, ethnicity, their background, cultural background, okay. And then these are all important in the overall history of the client with suspected renal or urinary dysfunction. So a sudden onset of hypertension in clients older than 50 years of age suggests possible kidney disease. So we have to make sure, we have to ask the patient according to the age, if they are 50 and above. So we have to ask, suddenly did they develop hypertension, because it has got associated problem related with kidney disease. And then clinical evidence of adult polycystic kidney disease typically occurs in clients in their 40s or 50s. In men older than 50 years, altered urine pattern suggests prostatic disease. So what is this polycystic disease? It is an inherited kidney disease where you will find non-cancerous sacs. So these sacs will be filled with water-like fluid. Okay, so many people with this condition have kidney failure by the age 60. So if they have developed this polycystic kidney disease at the age of 40 to 50, so most of them develop renal failure, okay, by the age when they are 60 years. So that we have to ask if there is any, evidence of adult polycystic disease. Okay, and then in 50 years, in men older 50 years, altered urine pattern suggests prostatic disease. So prostate gland. Okay, anything when it can be prostate tumor or inflammation of the prostate, it always interferes with the urination, okay, where the patient will be having urinary difficulty. So that's the reason we should ask that. Then anatomic gender differences make some disorders worse or more common. For example, men rarely have urinary tract infections unless these are abnormalities such as urethral reflex or prostatic enlargement. So in men in condition like urethral reflex. So what is this urethral reflex? The urine will flow backwards from the bladder into the ureter and sometimes to the kidney. So we should ask, okay, we have to assess that if the patient has got any abnormality like urethral reflex or prostatic enlargement. As I told you, prostatic enlargement, again it is important to ask because when the prostate is enlarged, the patient will be having difficulty in urination. Next, women have a shorter urethra and therefore more commonly experience cystitis, that is inflammation of the bladder, because bacteria pass more readily into bladder. So for women, the urethra is about 4 cm and the male it is about 9 cm. So that's why hygiene maintenance also is very important. So whenever women void or defecate, they should always clean from front to back. Okay, not from the anus to the urethra, always, okay, they have to clean from the urethra to the back, that is front to back. Otherwise, ladies, because of the urethra which is very small of 4 cm, it can easily lead to urinary tract infection and also causing cystitis. Next we will go to personal and family history. So what are the various history that we have to collect? Okay, we will see. So the family history of the client with a suspected kidney or urological problem is significant because some diseases have a familial inheritance pattern. So we have to ask if they are suffering with, if the family members, any of their family members have been suffering with certain kinds of renal disease, because we know that few are inherited. Okay, so that's the reason we have to find out. The client is asked whether his or her siblings, parents, siblings or grandparents have had any renal problems. Past terms used for kidney disease include Bright's disease, nephritis and nephrosis. Should also find out if there is any diseases like Bright disease. What is Bright diseases? It is a traditional name given to acute or chronic nephritis. Okay, so we also see that it is characterized by swelling and presence of albumin in the urine. So it is nothing but acute or chronic nephritis. So what is nephritis? It is an inflammation of the nephron or the kidney. So it can be either acute or it can be either chronic. And when the patient is suffering with this Bright's disease, he will also have swelling, and then the presence of albumin will be there in the urine, and associated we also see that the patient will be having hypotension or any kind of cardiac disease. So it is important that we check with the patient. Okay, so nephritis and nephrosis. So nephrosis again is a kidney disease where you will see that the patient will be exhibited with edema, loss of protein from the plasma into the urine. So you will find that there is presence of protein in the urine. Okay, so we'll have to find this. And clients may use these terms to describe kidney disease as it was known by their parents or grandparents in the early part of the 20th century. So they will be able to tell us if they were, if they had certain all these kinds of diseases. Okay, and adult polycystic kidney disease can occur in clients of either gender. So already we have seen these are sacs, right, non-cancerous sacs which has got water-like fluid in it. So they will be, this is very common in both male and female. Next, the client is asked about any previous renal or urological disorder including tumor, infection, stones or urological surgery. If the patient had underwent any kind of urological surgeries, or if he had before any complaints of all these disorders, then an history of any chronic health problems such as diabetes mellitus or hypertension may contribute to the development of renal disease. So we should be able to ask them if the patient he or she is a diabetic patient or hypertensive patient. So they should be able to check this out. The nurse identifies all of the client's prescription medication. So the nurse should be able to check with the prescription. Then the client is asked about their duration of use and whether any recent changes in medications have been prescribed. So we should also see if there is any duration of the use, for how long they've been diabetic or hypertension, what is the kind of medicine they are taking, whether their BP and diabetes is in control. Because if both are not in control, if the patient is not taking medications properly, then they will develop renal problems. Drugs prescribed for diabetes, hypertension, cardiac disorder, hormonal disorder, cancer, arthritis and psychiatric disorders are potential causes of renal dysfunction. So all this has to be assessed. Next, the use of over-the-counter drugs. So OTC, that is the over-counter drugs are agents including vitamin and mineral supplements and replacement. Laxatives are drugs which are given to ease constipation. Analgesics, non-steroidal anti-inflammatory drug, that is NSAIDs, is explored. So we have to find out if the patient had been taking any over-the-counter medications. For example, when the patient has got pain, automatically he or she will be going and asking every time, give me Dolo, give me Tramadol, give me Overon tablet. Without the doctor's prescription, they will be taking. Such medications are called as over-the-counter medication. So we have to find out if the patient is on any hormonal medication, non-steroidal drugs or steroidal drugs, analgesics, laxatives, hormonal replacement, vitamin replacement medication. All this has to be collected. Okay, so all this detail we will be collecting under family and personal history. Then additional information is obtained about the following, like chemical or environmental toxin, whether they are exposed to any kind of pollution, trauma, recent physical injury if they had, recent travel to geographical region to pose infectious disease risk, sexual contacts, and then history of altered pattern of urinary elimination. So all these details has to be collected by the patient. Next we will go into diet history. So what are the diet history that we have to ask? The client with known or suspected renal or urological disorders is asked about his or her usual diet and recent changes in diet. So ask about them, how many meals do they have, what is their normal diet plan, how many kilocalories do they, take, and then if there is any change. For example, if the patient has been on dieting, we have to ask them, because there are chances sometimes that they will be consuming high protein diet which can affect the kidney. So all these details we have to take if there is any kind of food which they've been omitting for a while, okay, or what is the kind of food they are taking, how much of carbohydrates, all these details have to be obtained. The excessive intake or omission of certain categories of food is noted. Information about food and fluid intake is obtained. If the client has followed a diet for weight reduction, the details of the diet plan are pertinent. A high protein intake can result in temporary renal problems. Then clients susceptible to calculi formation who ingest large amounts of calcium containing products or having an insufficient fluid intake may form new stones. So here we can see calculi, okay, the stone formation that has happened, and then what are the foods that they have been taking, how much of the, sometimes when they take too much of calcium, okay, like salt also they add into pickles, or they just add in amla and eat. So automatically what happens, the calcium increases, and calcium actually what happens is that also leads to the stone formation. So we have to ask them the full history and amount of fluid that they are taking. How much of the fluid are they taking per day? So that has to be asked. Then any changes in the appetite, okay, alteration in taste, acuity and inability to discriminate taste, whether they are not getting any taste at all after eating, and then if there is any change in the appetite, whether they have loss of appetite or whether they have increased appetite, all this has to be asked. These symptoms are associated with the accumulation of nitrogenous waste products from renal failure. Why are we asking? Because when the patient is having renal failure, or when the nitrogenous waste products are not removed from the body, then these changes can happen in the patient. So that's the reason we have to ask the individual regarding the taste. Changes in thirst or fluid intake may also produce changes in urine output or other evidence of urological disorders. So we should also ask them, are you having any problem during voiding? How much are you voiding? Are you voiding at all? If there is any difficulty, we will have to ask them, because it is related to urological disorders. So these are all the details to be obtained when it comes to diet history, both food and fluid intake, types of food, okay, and if the patient has been into any kind of dietary changes, that we should ask amount of protein, calcium, okay, or any kind of taste disturbances, thirst, okay, how much of fluid, is there any thirst that is exhibited in the patient, all this. Next, going to socio-economic status. So we will see what are the various socio-economic details that we will be asking the patient. So the socio-economic status of the client may influence healthcare practices. People with limited income or no health insurance often ignore physical ailments or delay seeking healthcare because they lack the funds to pay the diagnostic test or treatment. So usually this is main thing, though many times we are also from medical field. Whenever we have certain disease, we try to ignore going to hospital. So people who are from middle class or below the poverty line, when they are exhibiting certain kinds of illness in them, immediately they will not go, because maybe they lack money. Okay, they're scared of getting hospitalized and the expenses that can happen because of the hospitalization. So all this we can see in the patient. So when we talk about it, so we have to be very careful, okay, and assessing their socio-economic history and talking and asking the complaints, because many times they're not very free to come to the hospital to seek the treatment, maybe because of no insurance plan. Okay, so they may also have difficulty following medical advice, having prescription filled and keeping follow-up appointments. So they might also have difficulty in coming for the appointment again and again and visiting the doctor. The information that a client has about the disease and its symptoms may relate to educational level. So the information that a client has about the disease and its symptoms may relate to education according to their illiteracy or literate level. If they are educated, it is easy for us to communicate with them. If they are illiterate, again, they will not know the importance of coming to the hospital and keeping a check. The client's health beliefs affect, and their health belief related to health and illness, cultural background or religious affiliation also influences the belief system. The language used by the client may be different from that used by the healthcare professional. Anatomic or medical terms have no meaning for the client. While obtaining a history, the nurse listens to and explores the terms used by the client. By using the client's own terms, the nurse may help him or her to provide a more complete and thorough description of the problem. This technique may increase the amount of information communicated and decrease the client's discomfort when discussing bodily functions. So when you are talking, if they are illiterate specifically, if they are literate, no problem, nowadays they will be able to understand. But whenever you use medical or anatomical terms, make sure that the patient is able to understand what you are trying to ask them. If they are not able to understand it, then make sure that you explain to them in simple terms, and whatever you want to collect, the history associated regarding the renal disease with the patient, ask them in simple terms, and then you can convert that into medical terms. Okay, so next we will move into current health problems, and then we will go on to assessment of kidney, ureter, bladder. Okay, so I'll continue with the next video.